Hello, welcome to the Roselle Center for Healing webinar series. I'm your presenter, Dr. Stephanie Pina, naturopath and licensed acupuncturist. Today's lecture is going to be on pain management and acupuncture. Hopefully you'll get some great information on how acupuncture has been used in different pain management settings, as well as some basic information on how acupuncture can be explained from a modern day view. Let's go ahead and start the lecture. During this webinar, we're going to review a few of these topics. We're first going to review the problem with pain and why looking at pain in the normal way we usually do, whether it be acute pain or chronic pain, may not be the best solution to what we're trying to find for treatments. We're also going to discuss the classic theory and modern explanation behind acupuncture and how it can be used in pain management. We're going to discuss how acupuncture is a multifaceted approach to pain management that looks at not only just controlling pain signals, but also the effect that pain has on the structural, biochemical, and mental emotional side of the body. We're going to review some of the research studies that have demonstrated the effectiveness of acupuncture to create a true treatment plan that helps the body in many different ways. And we're going to list key aspects of acupuncture and take-home points that will be good for you to discuss with myself or another acupuncturist should you decide to use acupuncture treatment in your pain management plan. Over 1.5 billion people worldwide suffer from chronic pain. Nearly 1/3 of American adults experience chronic pain, and almost 1 in 5 surveyed Europeans indicate that they have moderate to severe chronic pain. The 3 most common sources of chronic pain are low back pain, neck pain, and severe headache and migraine. But the problem with just addressing pain as a symptom or a sign is that we're missing the underlying diagnosis. What's going on with the body and why is it not healing properly? Essentially, when we need to do this is we have to look at acute and chronic pain differently, and they should be addressed differently. Acute pain might be seen when we have an accident or an injury, and essentially we may see normal signs of inflammation such as redness, swelling, bruising, even muscle injury. But when chronic pain starts to take in, which is usually after 3 months, then essentially what you might not see is those symptoms at all. That kind of chronic pain can actually start to affect joints, range of motion, and even some of the organ systems. So it needs to be addressed differently to look for other sources of issues. We need to also look at addressing other physical types of issues such as mobility and other areas that might be getting strained from the different types of compensation pains. Emotionally, we have to look at treating pain because there's an increased rise in anxiety and depression during times of chronic stress and strain. And of course, there's a social and a financial burden as people won't be able to work as well, communicate well with others and their family and friends, and also usually they may not be able to go to work. So essentially that's putting more strain on the healthcare system, which is costing billions per year to treat chronic pain. In order to treat pain, you must address the many aspects of it and how it presents. This means taking a deeper investigation into how the body works and what is actually going on with the individual person that's in front of you. We do this at the Roselle Center Healing by looking at the triad of health, which is essentially knowing that health in itself is related to basically biochemistry, structural, and emotional balance. With these 3 in place, basically we can kind of help to treat chronic pain, acute pain, and a lot of other health issues. So let's start looking at pain from a different perspective. Overall, when we look at pain, we want to be able to identify where it's coming from, what makes it worse, what makes it better, and essentially what have you done that made it worse and better as well too. That way we can truly come up with the best treatment plan to treat, whether it's acute or chronic pain. So sometimes pain can be localized to a very small area, so it's easy to identify. Tightness in the shoulder, pain related to menstrual cramps can be examples of this. We can also have referring pain, which can be a little bit more tricky. The pain starts in one area of the body, but doesn't seem like it's actually related to that area. Pains such as referral pains might be like sciatic pain, where the pain's actually coming from a disc issue or nerve issue in the lower back, but we feel the pain traveling down the lateral side or the back of our leg. And pain can also be very generalized, where it's hard to determine exactly where it's coming from or really what it feels like. A lot of times patients tend to say they just can't put their finger on it. So essentially, all that's great information to kind of help us figure out what type of treatment will be best for them. Pain in itself can trigger stress responses, which is not uncommon. Not that none of us are either under stress either. Stress responses can kind of help also through our body by kind of being mimicked by digestive issues, respiratory issues such as allergies, and chronic pain in itself can look like a lot of different other signs and symptoms. There might be additional involvement in these different organ systems that makes it difficult or more complicated to treat. This might be example in different autoimmune conditions such as multiple sclerosis, chronic fatigue syndrome, and fibromyalgia, where there's not just one particular area, but a number of symptoms that go along with the pain itself. Pain itself can trigger emotional changes. As I mentioned before, we know that depression and anxiety rise with chronic pain use, but even knowing that something's going to create pain and even the treatment itself may be painful, that in itself has to be addressed as well. Pain can affect a number of multiple systems, and when we look at how acupuncture affects it, how acupuncture can affect the treatment of pain, essentially these are the systems we want to look at the most. The nervous system makes the most sense while it's transmitting the information from the pain source to our brain the way we experience things. The endocrine system is in charge of actually releasing different types of hormones throughout the body, and that can be related to different hormonal type of pain. The cardiovascular system has to make sure that we're sending the correct amount of blood flow to and from the area so that fresh new nutrients and oxygen is getting to the area that might be injured, but essentially also taking away inflammation and debris from healing. And our digestive tract's detoxification and elimination system might be affected because essentially we may be on pain medications that don't clear so well through the body. So these are all things we have to take in consideration when we're addressing pain, and also the different multiple factors that go along with creating a treatment. One of the interesting facts is that when we look at pain itself, 38% of pain can be coming from an injury or an injured source that we know of. 24% of it can be from musculoskeletal sources, but 31%, which is much more interesting, can be from unknown factors. This is the type of pain that's very difficult to actually treat because you have to find out more information from the patient, and not everybody's going to respond to the same treatment. And the 7% from the other types of pain that you see here can be related to cancer pain, different type of autoimmune disease pain, and different things that were not considered in the normal chronic pain category. So in order to best kind of understand how acupuncture and different modalities may affect our pain, we need to think about how stress actually affects our pain response. The autonomic nervous system is the portion of the brain that essentially we don't control. It is broken down into two different parts, the sympathetic system and the parasympathetic system. These play an important role because each does its own part to make sure that the body stays in balance. The sympathetic system tends to get our fight, flight, and freeze response. So it's going to increase our heart rate, tighten our muscles, and release adrenaline and norepinephrine so that we can get up and go. The parasympathetic system tends to be the rest, relax, and digest area. It also needs to kick in essentially to help us recover and heal over time too, so it becomes very important in a pain response. So what tends to happen when we have chronic pain or even intense acute pain? Our sympathetic system goes into overdrive, and essentially we're not allowed to have that time to heal. This in itself can lead to other conditions, and so that's why stressor tends to be a big issue with a number of different chronic health conditions. So what we need to do is try to identify different types of modalities such as acupuncture, meditation, and even exercise that helps to decrease the sympathetic response in order to let the parasympathetic response start to allow us to heal better. This is a main role that acupuncture does, is most people come in feeling stressed out and then they leave much more relaxed, but more on that later. So one of the main problems that we have to first recognize and address is that for chronic pain use and any kind of pain management plan, opioid medication and pharmaceuticals was always the first line therapy. Obviously, this became a major issue, and in 2016, the CDC had to actually create guidelines for primary care physicians that prescribed opioids to get a better understanding of where they should be starting with their pain management treatments. Unfortunately, the opioid crisis has led to increase of deaths from opioid overdose, increase of other narcotics such as heroin, and also a number of different side effects from these medications. So these guidelines came out at a perfect time, and the number one recommendation that they actually made was for physicians to start with non-pharmaceutical therapies and non-opioid pharmacological therapies as a preferred preference for chronic pain. This is a great sign for things like different alternative medicines because this is where we fall into, and essentially acupuncture being one of those therapies. By doing so, they were hoping that physicians would use less of the medications that may have to be increased over time and help combat different types of mortality and morbidity rates, and also the increased need for opioids. They suggested that opioids should be used, if they are used, they should be combined with non-pharmacological therapies and other types of therapies as well too. Acupuncture is great to fit into this category also because it's not only been used and shown effective to treat chronic pain and acute pain, but it's also been used as an adjunct treatment for actually treating opiate and different substance withdrawal symptoms. It's an adjunct treatment because it's used along with other types of treatments that they use in pain management clinics or detoxification centers. But acupuncture also can address the underlying health conditions that might be related to quality of lifestyle, stress, and the emotional being, which may be a major factor that was overlooked when pharmaceuticals were just simply given to judge and to deal with pain management. With increase of non-pharmaceutical therapies to combat the opioid crisis, acupuncture recognition has also been on the rise, not only to treat for acute and chronic pain issues, but also the other conditions that it's been known to treat as well too. A number of years ago, the World Health Organization created a list of 46 different treatments that acupuncture was known to treat well, effectively, and with safety. This particular list has been updated with modern day research. The World Health Organization has now included acupuncture in different types of traditional medicines, and their guidelines going out to physicians around the world. They'll be released in 2020. That means acupuncture should be a consideration for different types of pain modalities, but also different health conditions as well. Medicare started covering chronic low back pain as of January of 2020. This is essentially the first condition that Medicare has covered for acupuncture, and hopefully it leads to many more. With this, a primary care physician still has to write a script and diagnose chronic low back pain that's been around for more than 3 months, and it essentially allows patients to receive from anywhere from 12 to 20 acupuncture sessions over a 12-month period. Some insurance coverages have also added acupuncture into their policies. Of course, this also varies by policy and by state. Some of the things that they tend to cover, though, are essentially osteoarthritis, tension migraines, migraine headaches, and then nausea related to chemotherapy and pregnancy. This list tends to grow and also varies, like I said, state to state. So where there's more acupuncture presence and patients' demand, they've been increasing the list of different types of healthcare conditions that are available for treatment. So now that we have seen that acupuncture can be used in pain management situations, let's start reviewing some of the classical concepts of acupuncture, but then also apply a modern day approach to it. By better understanding some of the mysticism behind acupuncture and explain it in a modern way, we can understand how it can best be used in acute and chronic conditions, not only pain management for other healthcare conditions as well. Acupuncture in itself is a whole body approach, so it's a holistic approach. It's taking into consideration not just signs and symptoms of one part of the body, but essentially the whole body. If something's not healing properly, it may be because there's something that's being missed if you just address simply shoulder pain or headache. It also has to deal with the core concept of promoting health as a balance within the inside and outside, also within ourselves and our outside environment. So it understands that there's a balance between what goes on outside the world and what goes on inside our body. It's imagine a way of looking at what the foods, chemical substances that we bring into the body, how does that affect us? Does the weather affect us? And we see this with pain approaches such as different types of arthritises. We know that the storm is approaching outside, and so all of a sudden there's joint pain. There's also the idea that things need to be in balance. And this isn't a old school concept. It's also known as homeostasis. By creating homeostasis within the body, we can not only function better, but we can function at an optimal level. One of the key components of acupuncture is that a lot of it's based off of observational skills and knowledge. If you think about it, 3,000 to 5,000 years ago, they didn't necessarily have labs, tests, x-rays, and some of the information that we used from different types of machines now. They really had to talk with the person, observe what was going on, look at things such as their diet and lifestyle, and kind of what they did as a job to understand better what kind of healthcare conditions they may be suffering from. That information was used to create the best treatment plan for them at that moment. And sometimes it had to change day to day because you may observe something different with that person from time to time. And finally, acupuncture is part of a bigger system called the Chinese medicine, Oriental medicine system, also sometimes called East Asian medicine nowadays. This also includes other types of different therapies that would help to benefit. So while acupuncture might be used local to treat pain management, dietary suggestions or herbal medicine or exercise therapy might also be prescribed to essentially help get movement and function back into the body sooner. We'll review each one of these concepts a little bit more deeply, and hopefully that'll give you a better understanding of how acupuncture can be used in pain management situations. So as I mentioned, acupuncture is only a part of traditional Chinese medicine or East Asian medicine. It's an overall system that used to combine a number of different therapies in order to treat patients. So let's delve a little deeper into each one of these. Acupuncture, as I said, is probably the most popular one, and there's a number of different forms. Chinese acupuncture, Korean hand acupuncture, French energetics is one or a few of the ones that you can actually hear about. There's even laser acupuncture, which is using lasers, usually cold laser, over the points. And there's actually ear acupuncture, which takes into consideration that the body has microsystems. Now, this idea of microsystems works in a lot of different ways. It's kind of like someone goes in to get foot reflexology. The pressure points that they feel on the bottom of the feet are actually reflected back onto the organ systems. In ear acupuncture, you have a direct connection with the vagus nerve, which is known as the wandering nerve. This nerve can actually have a connection that goes to the heart and circulatory system, to the digestive tract, and also to muscles. So kind of like a good reset point. You have a direct access to the brain. This particular point, as long as other ear acupuncture points, are also used with withdrawal therapies, such as with opioid medications or other substances. Herbal medicine was also used commonly and can be put together with acupuncture. The herbs of Chinese medicine are a little bit different, although there are some crossovers with Western botanical medicine, and was usually taken as a tea or concoction and essentially drunk over a long period of time. The herbs might change on a very frequent basis, which is very different than, say, if someone has a supplement that they take for a longer period. Dietary and lifestyle therapies were also prescribed, although the diet that someone had 3,000 years ago may be very different than what they have now. That type of diet may seem actually simplistic compared to the restrictions that we may put on someone who is gluten-free or lactose intolerant. For example, if someone has a fever and is running high temperature, we may want to offer them cooling types of foods. Tuina massage and acupressure are more topical types of therapies. Basically, they serve the same as acupuncture except without needles. And essentially what you're doing is trying to improve localized blood flow and circulation to help relax tissues, tendons, and muscles. Acupressure can also be used with press tacks or with other devices that a patient can use and be sent home with. Movement and exercise was of key importance because people knew that in order to move, that would help out with their healing response. Different types of therapies such as martial arts and also Tai Chi and Qigong were put into place. These types of more balancing treatments, instead of an aggressive, rigorous jog or run or swimming, are actually great for someone who's trying to heal from chronic pain because it doesn't provide too much stress onto the system and can actually be done in a seated or standing position. It actually slowly helps to help out with their balance as well so they can regain normal functioning. Cupping or scraping or gua sha was also used to help promote localized blood flow to the area and also bring blood flow to the surface, especially with chronic conditions that weren't getting enough blood flow to begin with. Cupping in itself was actually made a little bit more popular after the last Olympics when Michael Phelps showed up at the swimming pool with essentially cupping bruises. Almost everybody came into the clinic wanting to be like Michael Phelps, but unfortunately you can use cupping for therapy, you still might not be like Michael Phelps. Gua sha is another version of it. It was just a matter of scraping on the skin and rubbing the skin so that blood flow comes to the surface. Along with these, there's been more modern types of techniques that acupuncture has used, and a lot of research tends to show that they use electrical stimulation on top of the acupuncture points. It may be similar to a TENS unit, but at much lower voltage. This kind of keeps a constant stimulation over time, and also in research, it kind of takes out of varying factors of what the acupuncturist may or may not doing to stimulate the needles. Things like press tacks or seeds can be used and placed on the patient to go home so they can kind of continue the therapy that they've been doing at the acupuncture office. It's just a little bit less direct. And finally, dry needling is an acupuncture technique that essentially is going directly into localized trigger points. When you're using this type of technique, which can be performed by physical therapists, it should be performed by a licensed acupuncturist, and essentially it's only working on that localized area instead of wondering why the body is not healing to begin with. Acupuncture takes in consideration, again, the entire body, so it has to bring into more information about how blood, nerves, and also the localized muscle areas are being treated. So now that we've reviewed different types of Chinese medicine therapies that are going to be effective for acute and chronic pain of different types, let's go over a common classic of how acupuncture works. A lot of times, acupuncture can be described as the movement of water, how qi and blood flows through the body. Now, getting stuck up on the actual terminology of acupuncture and the way that they spoke 3,000 years ago can be things that you see written online or in different articles. So we're going to take these concepts and look at them a little bit differently. Blood and qi are basically the two different concepts that we want to move slowly through the system. Blood can be the regular circulatory blood. It can also be other fluids. Qi, on the other hand, is a different concept and can be the energetics. Now that works for some people, but in modern day concepts, we don't have this idea of qi, this individual energetic force. But it can be the energy that where cell to cell talks, within a cell, how it creates different types of energies. But essentially what it also can be is what's essentially needed in order to function normal. So that can be like oxygen. So an easy way to think about acupuncture is that blood and oxygen need to move throughout the body in order to reach tissues or into an area where there's pain in order to create function and homeostasis. So if we look at this picture of water here, what we want is that continuous, nice flow of water throughout the body. As qi and energy flow throughout the body, so does an oxygen and blood flow. But then there's a problem. On the other side, you see that there's a beaver dam. So what if there's a blockage at this dam? It creates an issue at not only the blocked area, but it creates an issue on either side of the dam. This is kind of like an injury or a stagnation. On one side of the dam, you have an overabundance of water. So that can create issues like, for example, increased inflammation, increased toxic buildup, and also leading to more pain because there's more pressure on the nerves and localized tissue. On the other side of the dam, however, we don't get enough blood flow. There's not enough water going through the dam. And so that creates an issue as well too. So in this case, the tissues that might be downhill, say on the lower extremities, don't get necessarily all the blood and oxygen flow that they need to survive or to heal. So for example, if someone has diabetic neuropathy and there's pain, say, in their feet, that blockage may be higher up in their legs where the nerves have been affected by blood sugar levels. In order to open up the area, we have to try to decrease the ability for that dam to hold that water back. Slowly over time, that water can start to flow normally again if we remove the dam itself. So this is a basic concept of Chinese medicine, and even though it still might seem kind of odd to us in modern day terminology, there's a lot of great modern terms that can be used to understand from a physiological perspective what's going on when we do an acupuncture treatment. So now that we've covered the basic classical concepts of qi and blood, or oxygen and blood flow through the body, which is the ultimate goal of what the treatment is in order to help out with acute and chronic pain management, we need to look at how an acupuncturist might diagnose these types of issues. Essentially, there's a number of classical diagnostic skills that we are learned and taught in school that we use to kind of help identify how one patient's pain may be different from the other. The first one begins with inspection and observation, which, as I mentioned earlier, is very key. This can begin the second you walk into the room. How do you walk? How do you sit? How do you present? And essentially, we also want to look at the area where you have pain. Is there any discoloration? Is there any issues with bruising or bleeding in that area? Is there a lack of hair growth, or is it pale or purple, which means that there may not be as much blood flow getting to that area? Is there any swelling or tenderness? All these key observations are then followed up with an interrogation process, which basically is just questioning and listening to the patient's response about what's made them better and what's made them worse, what type of therapies and what's their past medical history been. Followed by this is going to be palpation. So a lot of times this can be actually palpating the body to see if we can find more tenderness in different parts of the body or along meridians. It can also involve tongue or pulse diagnosis. This is actually feeling the pulse, and in some ways you can think about it looking at how your cardiovascular system is getting blood flow throughout the body. It kind of tells me how strong the patient's constitution is. Are they going to be able to take an aggressive treatment, or do they need a weaker treatment, and it might be more building over time? Followed by this would be tongue diagnosis, which takes a lot of time to learn in Chinese medicine, but it's another observational sign. The tongue should look pale and moist, and essentially not have distended blood vessels underneath the tongue. Certain changes on the tongue's appearance could kind of help indicate how long someone's had a chronic condition or if this is an acute condition. And also if there's any underlying metabolic conditions that might be creating an issue for helping healing. Along with the Chinese diagnosis skill sets, we also want to take into any consideration modern tools like labs and imaging. This type of information is great to give us, but remember, it wasn't available 3,000 years ago. So our first classical diagnosis skills are going to be really important in order to come up with the greatest acupuncture plan for you and your type of pain. Acugraph helps measure how strong or weak the different acupuncture meridians are and can also help come up with which points might be the best for you. One of the key things as far as treating pain management, especially in a Chinese medicine standpoint with acupuncture, is the importance is put back onto the patient and their involvement and feedback that they give to the acupuncturist. Your feedback essentially tells me if we're going in the right direction or wrong direction. It also tells me if you're experiencing any other symptoms that were new. So I often tend to ask my patients when they first come in, is there anything new today? How is everything going? How did your last treatment go? By giving patients that involvement, they actually are paying more attention to their own body and their own symptoms and helping with the healing process. Again, we have to look at the whole patient and the whole picture. So sometimes that means thinking outside the box and discovering symptoms and signs that weren't usually part of the original pain management that, say, was that case that was taken earlier on. So once we've had all the information that we need to gather during the diagnostic section, it's time to start coming up with the acupuncture treatment. And this is something that people might be familiar with because they've probably seen an acupuncture diagram with the different acupuncture points before. The best way to explain how a meridian, which is the lines you see, and the acupuncture points, which is the individual points along a meridian is to look at it as terms of like a big map. And in this case, it's also great to look at it as far as looking at the DC Metro map. On one side, you'll see where the acupuncture meridian lines are. And the 12 different meridians plus 2 extras basically have all these acupuncture points on them. They don't look like they connect, but they really do. So you have multiple ways of treating one particular area because you have a different line to get there. Now that example is great to use the DC Metro lab. So for example, say you're on the orange line and you're at Vienna and you want to go to Metro Station, which is in the middle, which connects to everything else. There's a number of different ways to get there. You could take orange all the way through and keep riding, or you could get off on blue, you could get off on silver, you could get back off and pass it and come back. Sometimes that's necessary because the station may be blocked or there's not a chance to get off, you might miss your stop. So essentially the same thing kind of goes for acupuncture. Just because a meridian runs in a certain area or a pain is located in a certain area, say for example in the shoulder, it doesn't necessarily mean that you have to use a shoulder point. You may not have access to it, just like that station that was blocked. So essentially what we need to do is pick the right points on different types of meridians to make our treatment the most effective. So this might mean you get localized points, which are near the pain sources, or you might get what we call distal points, where are on different parts of the body. Again, this might be combined with other types of therapies in Chinese medicine in order to best come up with the treatment for your type of pain. So let's start to discuss how we can use acupuncture points and their locations to help actual pain treatment strategies. And so when we look at this, we can think about how the dermatomes and different points are actually connected. So on the left side here, you see a dermatome chart. And essentially what a dermatome is as a spinal nerve comes out of the back, it goes along to the sensory system along the skin and it covers a certain amount of area. So if you feel pain along a certain area, it actually is traveling back onto that nerve. Different areas are covered, like you can see, like lines on the body. Even the face has its own different sections. So if, say, someone comes in and they have Bell's palsy with different types of pain, if their eyelids or their forehead are affected, you may be able to use the vagus nerve 1. If their cheek is affected, you may use the vagus nerve 2. And if their lower jaw is affected, you might use the third portion of that nerve. But essentially what's kind of interesting is as those spinous processes have come out, there are already acupuncture points that are listed at each one of those sections. On the right side, you see a picture of the urinary bladder and the dew meridians. The dew meridians are the ones that you see directly over the spine. The bladder meridians are the ones that are actually located at the same parts where these dermatomes are. So 3,000 years ago, when they didn't have the idea of dermatomes, they definitely had points to understand that each spinal section did something. Now, we know also from chiropractic that each one of these nerves as they come out tend to affect a different organ system. So these points on the back are actually known as back shoes, and they can affect different organ systems, such as the upper part of the back may affect the lungs and the heart, where the middle part of the back and to the end of the rib cage would go around to actually affect the digestive tract. The lower part of the back, like L2 through S1, typically affects the legs as well too, since that's where their nerves are that reach an ending of the spinal cord and then go down to feed the nerves of the legs. So essentially, Chinese medicine knew of this concept of dermatomes and how to use it for treatment, but they didn't have the terminology. These points can be very effective in treating and give us another way to help treat different types of pain management skills. So another type of pain that we're going to cover is actually referral pain and how this can often relate to what type of meridian we use. On the left-hand chart here, you see a pain diagram that shows where different types of pain would refer to. Different types of pain, like where the diaphragm is located on the shoulder, clearly isn't located where the diaphragm is on the lower part of the ribs. That musculoskeletal pain can refer to this area, so people complaining of shoulder pain may actually have a breathing issue or their diaphragm may be stuck. Now, what's of interest on this one is that you see with the area of the heart, which is in gray. When people have heart or chest pain or angina, sometimes they'll tell you that the pain is actually over their heart, or actually they'll tell you they've had pain that goes all the way up to their jaw or down their arm. Now, what's interesting is the same nerve that feeds that entire area is thinking that there's something going wrong there, but the brain can't interpret where the exact pain's coming from. Now, in Chinese medicine, on the right-hand side, you see where the arrows are, and that is actually the heart meridian. So what's interesting is that referral pain pattern essentially matches up where the heart meridian is on the body. So you can use any part of those areas to help affect cardiovascular function and blood flow, the same way that a referral pain pattern can also show up there too. This is just another way that Chinese medicine can be explained from more of a modern day approach that kind of helps patients have a better understanding of how acupuncture works and how it may be helpful for them. So when we also think about what acupuncture points do on the body, we also know that there's a strong correlation between acupuncture points and trigger points. Trigger points can be those tough knots of muscle fibers that are kind of bolt together. They can be painful in themselves or pain for pressure. When you usually put pressure on, they can also have referral pain. But essentially, even though trigger points can be treated, they should be taken into consideration with the whole rest of the body. However, even studies from the 1970s have shown that there was a remarkably high degree of correspondence found between trigger points and acupuncture points, in fact 71%. They kind of suggest that some of the same ideas of where an acupuncture point can relieve pain would also be at that trigger point site. So this is really good because in some places patients can kind of pick out their own trigger points and tell you exactly where things hurt. So it's worth treating locally. Now those studies have been followed up, and even as of 2008, there was another trigger point study, and they basically compared 255 trigger points with 361 acupuncture points. And what they saw is quite the same thing. Again, the acupuncture points and the trigger points basically correlated. So 93% of what they found had the same anatomical location within 1 centimeter. 91% had the same kind of referral pain. So when they pushed on that muscle, they saw the same type of shooting pain. And 97% had the same kind of pain indications. So they were able to kind of see exactly what was going on in the area. Studies like these help to show that acupuncture points are basically trigger points in disguise. So now that we've gone over how acupuncture meridian points in the nervous system connect together to help out with pain management, let's go over how a different point might be seen. On this page, we have 2 different acupuncture points that can treat things both locally, but also at different areas. And they also treat different conditions. So on the left-hand side, we have the first point, spleen 9. This is located on the medial or the lower inner aspect of the knee. In Chinese medicine, the spleen is related to the digestive tract, and it also had to deal with water and fluid balance. So it was known as a damp point. It might help relieve different types of congestions of dampness and swelling in the body. So that's why the indications would be dampness and digestion, edema, and possibly urinary incontinence. But essentially, from an anatomical condition, we might also see swelling in this area from different types of pain issues from the knee, meniscal tears, or lower leg edema. This makes sense also from what we know of modern anatomy, since there's a large lymphatic drainage basin right there. So the lymph from the bottom part of the legs, which is helping to carry the toxic waste from the lower part of the foot, actually goes to this exact same area. So it makes sense that if something's backed up, just like our dam, we're going to have fluid that backs up in the lower part of the legs. So spleen 9 might be a great choice to use in this case. On the other hand, we have large intestine 20, and this is located bilaterally on the nasal labial grooves right next to the nose. Now, most people who have gotten acupuncture know that on both sides, this combined with one other point, this might be a great treatment point for allergies because it opens up the nasal cavities and allows air to kind of circulate through. It also is a great point when you're pressing it, it may be tender because it's located over the sinuses. So its indication actually for sinus pressure, allergies, and swelling in the face, plus nasal instructions, fits right along with this Chinese medicine indications from a number of years ago. Anatomically, we may also think about this for allergies, but a lot of time cosmetic acupuncture might be used here because there's the wrinkles, fold crease as well. These points can also be used not only just for allergies and localized pain, but it can also be one of the ones that I use to help out with dental issues since it follows some of the same nerve distribution. And it can also, it can help out with actually improving someone's taste perception. Just think about when you get a stuffy nose or a cold, your taste perception and your appetite goes down. So patients who aren't eating as well because they may be in pain or under the influence of some kind of medication like a chemotherapy drug tend to lose their ability to taste and smell food. So this is a great point for that as well too. Many of these points are used for different indications and can be used in combination with localized points as well. So that gives you an example of how a point might be used versus just simply following its nervous system distribution. Now that we've been able to see how acupuncture meridians and points affect different parts of the body due to their location near or around nerves, blood vessels, different musculoskeletal types of issues, and also the lymphatic system, we can now dive into a little deeper on how acupuncture works to help relieve acute and chronic pain. Because acupuncture has a number of different ways it works, it can address a number of different types of pain. And the great thing is that you might be able to use acupuncture along with other types of therapies to help create a better treatment plan. One of the ways that acupuncture works is by releasing powerful painkiller and anti-inflammatory substances from the brain itself. These can be endorphins and enkephalins, which are simply opioids that the body produces naturally. So instead of having an opioid medication, we can increase the body's own ability to produce its opioids to control pain. The great thing also is that these different chemicals also help to relax the body. So not only is there pain management, but there's also relaxation. The body can change the way that it responds to different types of stressors as well too. And those different stressors, as we saw, can affect different organ systems and the way they function. So now you're affecting not just the pain area, but a number of different areas. And finally, it can have a local effect that causes muscles to relax or contract depending on what's going on. It increases blood flow circulation, but then it also kind of helps to decrease stuck blood that's in the area to eliminate lingering inflammation. Acupuncture's multiple ways that it works is going to be addressed in the next few slides. But first we're going to look at what happens when you actually insert a needle. What's the response that actually happens there, and what are the systems that have to happen in order for there to be a response. So let's review what actually happens when we insert a needle into the body. Acupuncture works by essentially creating a localized response, but then also has to be interpreted by the brain as well too. It does this by a number of different levels and ways. So the needle that goes into the skin, which is a small stainless steel needle that's sterile and one-time use only, goes into basically the skin, fascia, or muscle layer. From there, the brain realizes that there's something going on in the area, just like if there was a cut or wound, and so it has to send reinforcements to go check it out. That might be blood flow, or that might be the local release of different chemicals. When their body realizes that there's not any injured tissue there, we can utilize the nervous system and also the different levels of the spinal cord to help relay information about different types of pain responses, and which helps us to come up with the different types of treatments. You can have an effect at the spinal cord level or in the different deep parts of the brain. This helps to release different neurotransmitters as well that helps out with that feeling of relaxation that is part of an endorphin response, or to help out with muscle memory that might be related to like almost trigger pain. Acupuncture in itself can affect the body in a number of different levels. It can also affect the organ systems as well too. So if you're needling near a nerve that's going to go to the lower part of the spinal cord, you may also be able to affect the digestive tract. So that explains how some of the points on the lower part of the body, namely say on the stomach meridian, which is below the knee, might affect the stomach actual location. They're using the same nerve pathway to travel basically and send information up to the brain. It sounds complicated, but it actually is a well worked out system. An acupuncturist thousands of years ago knew that there was some kind of connection with the higher parts of the brain that fed into the lower parts of the body. We're going to continue with how acupuncture actually works. So now let's talk about how acupuncture can actually work on a couple of different ways to treat acute and chronic pain. What's actually the mechanism of how it's actually working, no matter where you put the needles. There's a couple of different ways that this has been looked into, and research has been looking into how acupuncture works for a number of years. The problem is, in a lot of research studies, is that there's probably more than one mechanism and work every single time you needle somebody, just like there's more than one needle position that you could use. Multiple points may be able to help out different types of pains. So the first way it might be able to work is that it's under the pain gate theory. And basically what it is if you're using the needles to hyperstimulate the area. So essentially you're creating a pain gate around that painful area. So the body kind of forgets that it's actually there. In some ways, this is kind of like when they tell you if someone stops on your foot and essentially you forget about your elbow pain because your brain is paying too much attention to your foot. Acupuncture can also change the muscle action potential. So basically an action potential is an electrical signal that has to fire in every single muscle in order for it to contract. Once that firing kind of contracts and the muscle runs out of energy, it ends up releasing. When you put an acupuncture needle directly into the belly of a muscle, it actually can cause that muscle to contract underneath it. So this can be good to kind of help release painful tight muscles in order to prevent them from continuing to stay tight in a spasm, but again to relax over time. The third way acupuncture can work in the body too is it helps to release those natural opioid systems and pain modulators that we spoke of earlier. By releasing endorphins and enkephalins, essentially you're modifying the pain levels that how the brain feels pain, and then also helps to relax the rest of the body. The less stress on the body, the more energy can actually go into healing. It can also stimulate the hypothalamus pituitary adrenal axis. So this is a deep part of the brain that helps also to control hormone release. Some of the hormones released can actually affect our long-term stress releaser hormone called cortisol. It can also help to deal with some of those muscle memories as well too, where the body remembers that there's pain in a certain area. So we're essentially affecting the endocrine system and the nervous system at the same time. It can also regulate the autonomic nervous system. Now, we spoke about this system when we talked about how stress and the pain response reacts. This is that fight-flight response. So we want to decrease how the body perceives the stress in order to allow the parasympathetic system to essentially be able to rest, digest, and actually heal. And finally, can promote a lot of relaxation. Most patients come in and after their 25-minute treatment, they feel very relaxed and they feel like they can actually function. This can be a big benefit, and it's a huge benefit if, say, someone's not sleeping or they can't relax because they're constantly dealing with pain. We're going to review the inflammation response, which is a normal response that the body has when there's any kind of trauma. We want an inflammation response to happen, and so in acute pain, this is usually what we're feeling. Because of the increase in blood flow and different chemicals that alert the body that something's happening into tissues that may be injured or into organ systems, there can be pain, redness, swelling, and heat as blood flow starts to go into that area and infiltrate it. Now that's fine because this shortened response should actually start to clear out as the body starts to heal. But what happens when it doesn't clear out? That's when we usually have things like chronic inflammation. The unfortunate thing is chronic inflammation doesn't just affect the local area, but it can start to affect the local organ systems as well too over time. This is why chronic inflammation can be part of a factor that leads to a number of different diseases like cardiovascular, neurological, autoimmune, cancer, fibromyalgia, and chronic fatigue syndrome. So by decreasing inflammation, we're working to actually help the body not only prevent these diseases, but help the healing process as well too. Chronic inflammation is harder to track because it kind of spreads out throughout the body. It's not as acute, it's not as localized as acute inflammation would be. But the one thing that acupuncture is good at is treating the inflammation response, no matter where it's located. We're going to show you that as an example. So now let's take a look at an idea of how acupuncture can treat localized inflammation. And we're going to use modern technology, namely thermography, to actually show you how that happens over time. So what you see on here is a series of pictures that's taken by a thermography machine, and essentially it's of a knee. The first picture shows you before any kind of treatment was done, and you see redness directly around the knee itself. So this might be a common situation that you might see with someone who has arthritis of the knee. Essentially, the next couple of pictures actually has the needles inserted. So if you look, there's barely see in the second picture that there's some light blue lines. Those are the actual needles inserted in and around the red spot. So as this happens, these pictures are taken every 5 minutes. Towards the end, you actually see the last picture when about 30 minutes of treatment has gone on and the needles have been removed. Now, the amazing thing that we see on this picture is not only is there less inflammation around the actual knee itself, as we see since the heat from the inflammation has now disappeared and become cooler back to normal temperature, which shows up as greens and blues, but you also see this in other areas of the body where there weren't any needles. Look down on the person's calf on the lower part of the leg. In the first couple of pictures, you see a bright yellow line that's kind of going down there. So there's heat and inflammation in that area. The needles aren't located there, they're located by the knee. By the time you get to the last picture, because the inflammation around the joint has been able to open up, the inflammation on the lower part of the leg has also gotten better. This is a good example of how movement of blood flow can actually cool inflammation down, and after a 30-minute period, you're actually already seeing a difference. Similar types of examples have been shown before, and so it shows you that you don't always have to have long, aggressive treatments in order to have basic responses to help out to treat pain and inflammation with acupuncture. So let's start to review some of the acupuncture research that's been available. Over the last 20 years, especially for pain management, there's been an increased rate of research compared to conventional medicine research. With that, over 13,000 studies conducted over 60 countries have been able to be pulled together. And thanks to things like the internet and certain advocacy groups, they've been able to collect this to make it much more available for the public, for practitioners, and to help prove to insurance companies that acupuncture needs to be covered. Of that research, 1,000 systematic reviews were found. Now, systematic reviews are great because they're essentially the summary of all these other research articles. So if someone was doing a systematic review on headaches, for say, what would happen is they would review all the different headaches articles out there and kind of throw out the bad ones and then get a better idea of what if acupuncture was actually beneficial for headaches. It's a great way to start pulling together what acupuncture and how it might be able to work and if it's beneficial or not. That's what the World Health Organization used when they came up with their list of 46 different types of treatments. They used these types of research articles. Now, the research over the years has covered a lot of different things. They've covered the mechanism about how acupuncture works, which we've covered earlier. They've covered the treatment of L.Ac. Is it better or worse to treat certain types of conditions? So would acupuncture work to treat cancer pain? Would it be worse to work to treat autoimmune disease? And how frequently that would be? Are there certain points that should be beneficial for certain things? And this you see also in a number of different fields outside of pain management, such as fertility, insomnia, and digestive issues. They've also did research to see if different types of protocols versus individualized care would work best. So a protocol would obviously be a set number of acupuncture points at a set number of time that everyone could kind of follow like a cookbook recipe. Individualized care might be involving some of those protocols, but then they've also taken into consideration maybe perhaps some points to help calm the person down, to help improve blood flow, even help just straight with relaxation. So they've made tweaks and changes on there. So not everybody in the study got the exact same treatment. They've also used different research studies to compare acupuncture to the standard of care. Now, this is important when you're trying to figure out if acupuncture would be a better treatment in certain situations than another form. Often nowadays you're seeing acupuncture being used better than, or showing better than, say, a certain medication. And I'll show you a study on that in just a second. And then finally, you're seeing not only acupuncture being studied, but also other areas in Chinese medicine, such as herbal medicine and even Tai Chi. Tai Chi in itself has a large research study that's being done on how Tai Chi affects osteoarthritis and bone mineral density, which makes it a great exercise for someone who feels like their body is not stable enough to do hard cardiovascular or activities. And herbal medicine itself, on how different herbal components basically are broken down and how they can affect different types of health conditions. One herbal remedy that was recently researched could potentially replace interferon therapy for hepatitis pain. That particular remedy was used way back in the day for essentially treating cold and flu issues. So acupuncture research grows, but not only by itself, but also within the Oriental medicine system. So let's review some of the acupuncture research that's been important in pain management settings. There's a reason why each one of these are on here, and I'm going to go through that. The great thing is that all the other research that's available can be actually found on our source here, evidencebasedacupuncture.org. That resource and some other resources at the end of the PowerPoint will be great ways to find the links to other types of resources, whether it's for pain management or for other healthcare conditions. So I highly encourage and thank this particular organization for being such a great advocate for acupuncture research. The first research study is what basically insurance companies use to start covering osteoarthritis pain of the knee. And what it did is it found that when they compared acupuncture treatment for osteoarthritis compared to other types of treatment, acupuncture actually did best with most patients. They actually had less side effects as well too. So acupuncture outperformed using just exercise, weight loss mechanisms, and what they call sham acupuncture. Sham acupuncture can be a number of different things, and it's basically trying to fake acupuncture or use it as control. You'll see this quite frequently in research studies. There is question on whether or not a sham acupuncture treatment can actually be made. Essentially, someone should know if they're getting stuck with a needle or not. So sometimes the sham acupuncture will use a needle insertion somewhere else that shouldn't be related to what they're treating, or they won't even needle the person at all. So in this particular case, though, acupuncture showed up better than essentially the usual care of treatment, including exercise and weight loss. The second treatment actually shows that both back pain was been able to treat in both an acute setting, a chronic setting, and also can last up to 6 months. Now, studies like these were what essentially Medicare would have been looking at when they decided to cover chronic low back pain in their 2020 insurance coverage. Overall, what's interesting is it not only shows that different types of back pain, low back pain can be covered, but also kind of gives us a duration. After a certain number of treatments, how long would that effect last? That's one of the common questions I get asked. How many treatments do I need to get, and how long is this going to last for? Do I have to keep coming back over and over again? In this particular case, they were able to see that the effects actually lasted up to 6 months when they followed up with the patients after treatment. The third study listed here actually talks about headaches and migraines. It's another condition that's typically kind of covered by insurances. And what they saw, though, is they compared that acupuncture actually seemed to work better than medication and had fewer side effects. So that's a very interesting thing because headache medications can range. Sometimes people will have antidepressants and different pain medications or even Botox injections to treat headaches and migraine pain. A lot of those medications may have been used originally for something else, but acupuncture in itself can treat a number of different types of headaches. This is where that observational skills and getting information from the patient helps us to determine the best type of treatment for each type of headache pain that comes in. And finally, the last study, even though it's not a pain management study per se, was included. The 2018 study that showed that acupuncture was more effective than drugs for treating chronic constipation and created fewer side effects is actually very important in a pain management kind of person. And the reason is that a lot of the pain medications, especially the opioid-based ones, one of the main side effects that patients had to deal with is the fact that chronic constipation was always an issue. That's because of the way that it worked on the nervous system. It actually slowed down the digestive tract, creating constipation issues. So in this particular case, it's not necessarily treating the pain per se, but you may be able to use acupuncture with a patient who's on opioid therapy in order to help relieve some of the side effects from their medication. Certain medications that can't be taken off of or adjusted easily, acupuncture can work to help balance the system as much as possible and treat the side effects while their pain medication is still managed in other ways. One of the other questions I get asked often about acupuncture is how safe is it? You are working with sharp needles, so how safe is this to the patient and to the practitioners? The good thing is that some of the research that's been done has actually looked and identified that as well too, reporting that there is very infrequent numbers of serious side effects. And that's also done when you have a qualified acupuncturist who demonstrates knowledge of anatomy and physiology, practices clean needle techniques, which essentially is using only a needle one time, disposing it into a sharps container, much like a blood draw needle afterwards, and then also following up with any other side effects. Essentially, this has to meet multiple standards for the state and also with the World Health Organization. So that's why it's so important to get acupuncture by licensed acupuncturists. The safety of acupuncture also essentially has to do with what the patient information we get. Certain safety features have to be taken into consideration, and protocols are made for patients who say are super sensitive to needles, have a fear of needles, and also essentially may be on blood thinners or different types of medications that might interfere with the acupuncture technique. Each acupuncturist needs to address that individually with their patients and make sure that they and the patient feels comfortable with doing their procedure before moving on. Hopefully that gives you an idea that acupuncture quite has a safety protocols in place, and that is a safe procedure overall. So I wanted to show you an example of how multiple different practitioners can come together to treat something in pain management. So in this particular case, we have a sciatic case. It might be typical of the Roselle Center for Healing. And we might have myself, the acupuncturist, a chiropractor, a nutritionist, and even a massage therapist all working on the same patient. They might be coming at it from different perspectives though. So in this particular case, we would all take a similar intake and ask the same questions about what made the pain worse, better, how long it's been going on for, any other issues that might be going on with the person to understand the idea and the quality of the pain better. We might do some kind of observational testing, leg raises, see if there's any muscle tightness, and actually follow around where we see tender spots due to nerve instructions. Is there a tight muscle in the glute area as well too? From an acupuncture standpoint, I might need very local to that area, so into the urinary bladder meridians that you see here on this picture. I might also apply some heat, which helps to relax the muscles in and around the joints, the ligaments, the tendons, and actually kind of follow down with the patient and have them take pressure tacks home, so that way it can continue to the treatment once they get at home to help alleviate the pain. The chiropractors may also do a postural assessment and adjust the lower back to make sure that it's in alignment and so that the nerves can actually fire properly, that there's no blockage. They may also do another type of therapy such as ultrasound to kind of relax a tightened muscle, and they may also provide heat or cold as well too. It kind of depends on what information they find out during their assessment. Some kind of exercise or rehab might be given, or for those who are patients who are overactive, rest may be prescribed. The nutritionist may come in and actually realize that this patient has a really bad diet, and essentially they need to have a diet that's made up of anti-inflammatory foods. So they might make adjustments there to make sure that the inflammation that's going on with their sciatica can decrease. They don't want to add to the pain. They want to try to put the body in the best possible place to help out with healing. They may also add supplements like herbs like turmeric or digestive enzymes that, taken away from a meal, can actually help decrease pain as well. And they may also review the person how hydrated they are. Have they been drinking water, which helps to relax muscles, open up joint spaces, and kind of get blood flowing into the area. Supportive braces, tacks, and other heat or cold instructions may be given to this patient as well, so that way they are able to kind of continue their treatment while at home. So each person has addressed the same issue, they've just addressed it different ways. They can kind of look at the same box from different angles, and that's really the benefit of when you combine treatments together, you can get the best out of it. Each person has addressed the localized muscle tissue, the nerves, and the surrounding connective tissue. They utilize rest or motion to help return normal function back to this person. And they've also addressed underlying inflammation issues by seeing what the person may not necessarily be thinking of. Why would their diet have anything to do with their leg pain? Why would constipation be part of this at all? And what it really does is it provides not only acute care relief so that pain can be eliminated, but it helps to identify any chronic issues and support the normal healing process. That's really the benefit of using multiple therapies at the same time and really figuring out which therapy can offer the best type of support. This is a typical type of treatment plan, and it may be available to you where you are and also at the Roselle Center for Healing. So let's review some of the key concepts that we've learned during this webinar on acupuncture and pain management. The first all should be that each individual patient has to have their own treatment plan, even if they sound like a patient that comes in for the exact same issue. No two patients are the same, so the treatments must be individualized to each patient's goal and expectations. If someone wants to work on just improving pain management, we have to keep that in mind. If someone wants to work on pain management and to improve quality of life or to prevent additional injuries and accidents later, we need to come up with a longer treatment plan. So that needs to be taken into consideration. We have to meet the patient's goals as well as perform our medical services. Acupuncture is based on the idea of balancing the body to promote health and healing and to optimize function. Hopefully, by going through some of the ideas of the classical techniques and how we can explain those in modern day terminology, you get a better idea that it's not a mystical science anymore, but essentially it's based off of physiological changes that can be made in the body to help out a healing response. If I've done that, then I've done my goal. Acupuncture creates a physiological response in the body to influence multiple systems. So that might include the nervous system, the cardiovascular system, the digestive system, the endocrine system, which releases hormones, and also the ability for the brain to produce chemicals that help us with pain responses. That can be used in acute pain and chronic pain of a number of different types. So whether someone's coming in with cancer pain or they've simply had a low back pain, essentially you have to evaluate each one of those patients for where they are at that moment in time and come up with the best treatment plan for them. The type of treatment you decide to give them is going to have these physiological changes and responses. And then you get to follow up with them, give them their homework, and see how they respond. The research for many healthcare conditions have been done, and acupuncture has been shown to be effective, safe, and is also gaining acceptance. More and more people know someone else who has also had acupuncture, and whether they've had positive or negative results, they've been able to at least experience what acupuncture can do for them. More people have come in and at least been able to relax on the table, and so that might be something that helps them in their healing response at that time too. Other holistic therapies such as chiropractic, nutrition, lifestyle changes, movement and exercise therapy can all be combined with acupuncture to optimize healing for many conditions, including acute and chronic pain. You've seen this in the last example, and even though every patient may not get every single one of those services, there are times when we have to evaluate when additional services might be needed. And then when that happens, basically the patient's feedback helps us determine if we're moving in the right direction. So if you ever have any questions, whether it's about acupuncture or any of your services, make sure you talk to your doctors about essentially what the goal is that you're going for, and make sure you fill them in on how you feel after treatments and if you have any other new conditions as well too. I wanted to briefly address some of the common questions that I get asked in the clinic. Since this is not a live in-person lecture like we normally do in a webinar, unfortunately I can't take your questions directly, but these are some of the common ones that I get asked. On the next page on the resources, you'll find my direct email, so feel free to email me anything, and I'd happily get back to you to answer your direct questions. How are acupuncturists trained? Acupuncturists basically are trained in 3 or 4 year types of programs, which are either a master's or a doctorate level. They essentially have to sit 4 national boards in most states, and then the state determines what their scope of practice is. Acupuncturists need to essentially do continuing education to keep up with what their training is. And in certain states where they're allowed additional types of rights and scopes of practices, like injection therapy or the ability to write labs, they have additional training in that as well. How big are the needles? Well, I basically put a picture on here to show you just how tiny the needles are instead of how big they are. Essentially, the gauge of the needle is the higher the gauge number, the smaller the needle. So compared to even a sewing needle at home, your acupuncture needle is much smaller. I always tell people when they think about it is you can put 5 or 6 types of different acupuncture needles inside a blood draw needle. An acupuncture needle is also a solid stainless steel needle, so it's not hollow like you see that medical syringe or a blood draw needle. Nothing needs to go through it and nothing's on it. So essentially you have a sterile stainless needle that you're using. Are the needles safe? I think we addressed that earlier in one of the other questions, but essentially we wipe down the area with alcohol similar to a blood draw, and once your needles are done, they're done. They go into a sharps container not to be used again. The safety of the needle and the type of treatment that you're going to get will basically depend on what information you share with your acupuncturist. As I mentioned earlier, someone that say is on blood thinners or has a fear of needles may need to have a slightly different treatment at the beginning than someone who feels perfectly comfortable with getting acupuncture. Will they hurt? There's different pain sensations, obviously, and what I tell patients is usually people are aware when the needle goes in, but shortly after they don't feel them anymore. If someone was to move violently on the table, essentially they might be able to feel the needles, but you're not essentially stuck to the table. If you move nice and slow, the needles are actually thin enough to move with your body. So that does give some patients a relief that they're not necessarily stuck to the table. Essentially, also what happens too is that in certain areas, there's more muscle, which actually helps to protect the needle and holds the needle in place more, so you feel it less. And in other areas, like at the end of the toes and the end of the fingers, there's more nerve senses. That's normal. And so you might be more aware of that for the moment when the needle actually goes in. But overall, most patients find themselves relaxing quite well after the treatment and during it. And when they finish, a lot of times they're actually coming in, and the most scared patients of the acupuncture are actually the ones that fall asleep the quickest. We try to make the room as comfortable as possible to help out with that by providing heat on the feet and on the bed, and also providing soothing music as well too. Most acupuncture centers might do something like that, but it's a standard at the Roselle Center for Healing. How many sessions will it take to make a difference? That can really depend on the patient, and that's why their feedback helps me determine what points I need to use, but also essentially how long they need to come in for and what the frequency should be. So that will come up with an overall treatment plan at the very beginning once you experience your first acupuncture treatment, so I can kind of understand how your body responds. You're a part of this equation, so you help me to determine how many sessions you're going to need. Just in general, though, acute treatments like accidents, and injuries may respond quicker. Just like children may respond quicker. The immune system and the healing system is actually more engaged, so they're able to respond better, and they may not need as much treatments. More chronic conditions or that involve multiple areas and multiple organ systems may need more, and maybe more of a gentle feel at the beginning. Why didn't my doctor mention acupuncture as an option? Unfortunately, a lot of doctors don't know, or they question how acupuncture works, so lectures and webinars like these are actually great things to share with them. One of the things that they will start to realize is that as more insurance cover starts to include acupuncture in their policies, they'll start to have more patients request it. So I always encourage patients to talk to their healthcare providers and their insurance plans to see if acupuncture can be covered and what it covers for. Each plan can be a little bit different as far as if they offer a percentage or a number of treatments. Also, doctors tend to think that acupuncture is still that mystical type of medicine. These types of lectures that explain acupuncture and by its physiological effects are great ways to help open up the communication with doctors and really explain to them how things work. That communication between all the doctors is a great thing because everyone should know what their patient is being used and treated for. You should always tell your doctors that you're getting acupuncture or if you're on different types of supplements or medications. And finally, are there needleless techniques? And we went over that. There can be laser acupuncture. Press tacks go directly on the top of the skin, so it's not exactly like that. They're similar to acupressure. Tuina massage is a more aggressive type of massage, but sometimes that can be used. Cupping and gua sha is another example. And even sometimes some of the acupressure techniques that I've had patients kind of do on their own, they found them on their own and they've been able to tell me different techniques of how they stimulate acupuncture points. So we're always open to using what the patient feels most comfortable with. These are some of the questions, and I'll hear from some of you, and we'll answer them as well too. I always feel open to ask any questions that you need to of any acupuncturist. Hopefully during this lecture, you've actually come up with some questions and want to do some of your research on your own. And that's perfectly great. I've left some resources for you so that you can actually do some of that on your own and ask your own questions. Like I said, I'm more than happy to answer anything. So I've left my personal email, which is a HIPAA secure email on here at the Roselle Center. It's s.pina@rosellecare.com. And the office phone is 703-698-7117 if you also need to reach me that way, or you need to want to make an appointment to come in to see if acupuncture is correct for you. There's a number of different websites that are going to be beneficial, and some of these have the links to a lot of the different researches that we didn't get a chance to cover here, but they essentially are different types of advocacy groups that have pulled together a lot of resources. The Acupuncture Evidence Project was actually set up in Australia, and they did multiple rounds of reviews updating their acupuncture research by condition. Their PDF is actually available here, and so it's a great thing to review if you're looking for evidence based off of a healthcare condition. Evidence-based acupuncture, the website, and their summary reports are also listed here. Under the summaries themselves, they actually have different types of conditions, and they're easy to read summaries as well. The one that also is listed here is for pain, but they do have one for depression, anxiety, and other types of conditions. So they're highly effective in showing how acupuncture can be used for other conditions. In the past, there was a BBC documentary called The Science of Acupuncture, which is available on YouTube. It's about an hour long. It's an interesting look at how acupuncture was actually researched. And so what they did is they looked at functional MRIs and tried to see if they could activate different parts of the brain and see where it was happening during an acupuncture session. Their goal was to basically see if the brain was responding to where it should be responding when you stick an acupuncture needle in. And they actually found some positive results. So it's a nice documentary to look at there. Dr. Roselle also mentioned the movie 9,000 Needles as well too, and that should also be available probably through Amazon or Netflix. And also, if there's any information you need on acupuncture certification or training, as each scope and licensure depends on each state, this is the national organization which helps to govern most states, nccaom.org, and under that you can also find the link to find a practitioner where you can actually put your zip code in and how many miles radius you want to see if you can find someone in your area. These are licensed acupuncturists that have actually taken a national board exam. Some of them have Oriental medicine degrees, which means they basically have more training in herbal therapy, or they might be diplomats in acupuncture alone. Myself, I have an Oriental medicine degree, and so I think it actually helps you understand better the drug-herb interactions and acupuncture drug interactions as well. But those are listed there as well too. Hopefully these resources will help you provide more information that you might need, and also to ask any other questions to an acupuncturist in the future. I want to thank you for watching this webinar on acupuncture and pain management. Hopefully that you were able to take something away that acupuncture can be used for acute and chronic pain, and also a number of different types of pain conditions. The treatment really depends on the information that we get from each individual patient so that we can modify their particular treatment plan. And since acupuncture works in a number of different ways, it works great for a number of different varieties of different types of pain. That being said, we want to also offer you a chance to come into the Roselle Center for Healing while you have a chance to help others. The Roselle Center for Healing has been working with the charity Caring for Others, which is a 501c3 charity, for a number of years. Each of the doctor donates their time in order to see new patients come into the office, or existing patients that haven't been in for over a year. What this does is it gives a chance for patients to come in and really meet with us one-on-one and have a chance to find out if acupuncture or other therapies may be best for them. This is usually anywhere between an hour to a 90-minute consultation, which is usually worth $225. But for a donation for $99 to the charity of Caring for Others, we're able to waive that fee, and then the charity gets all the profits. That money actually goes towards a number of different things, including education of the public on natural solutions for common and chronic conditions. It helps provide healthcare services for those who can't afford it. And it also helps provide scholarships for those who are pursuing a career in chiropractic, applied kinesiology, acupuncture, and nutrition. They'll greatly support your donation. In the meantime, what you'll get is a chance to sit down with myself and go over your particular issues. What have you been dying to ask me personally, and if acupuncture can be part of your treatment plan? This 90-minute to 120-minute meeting basically is a chance for us to review everything that you've done and where do we move from now. We'll come up with a treatment plan that works exactly for what you need. And essentially, that's something that can be shared with other healthcare providers too. I want to thank you again for watching this webinar, and again, hope you learned something. If I taught you one thing, then I know I've done a good job. Feel free again to reach out to us at any time, and hopefully you'll also see you soon live in-house at some of our lectures. You can also listen to the recorded radio shows as well at our YouTube channel for Dr. Tom Roselle Live. Hope to see you soon, and please take advantage of this great special for caring for others. Thank you very much.